Hello, I am Dr. Surajit Gorai, a consultant dermatologist from Apollo Gleneagles Hospital, Kolkata. Today I will discuss a topic that is very troublesome to many persons, many patients, that is called hives or urticaria. In hives, many a times you will get a red itchy bump on your skin that lasts for some time and then goes away. Sometimes it may be so severe that when it's there, you have to scratch all over the time, and until unless you take the medicine for it, it won't go. So we got lot of patients of that, and it's really bothering them for a considerable amount of time, like few years. Why it happens? In our body there is a chemical called histamine. Due to some allergic reaction, when there is release of histamine, it causes hives. So what are those conditions when we can have hives? First of all, you need to check that you are taking any medicines for any other cause or not. Like if you are taking painkillers that we call as non-steroidal anti-inflammatory drug or NSAIDs, it may cause aggravation of your hive symptoms. Second is your BP medications like ACE inhibitor, captopril, lisinopril, these are the medicines. If you are taking, it may cause hives on your skin. If you are getting sting bite like a bee bite, like a bite from other stings, you may have allergic reactions and urticaria. In some disease, some autoimmune disease like Sjogren syndrome, SLE, rheumatoid arthritis, you may get this type of hives. Sometimes patient may get it due to excessive pressure. When they are having their waistband, their bands of clothing, they may get itching and red bumps on that pressure surfaces. So at that time you have to be cautious about it. Sometimes a patient may get due to excessive heat, patient may get due to excess cold, or sometimes due to perspiration, and even in psychological stress. When the patient is in depression or anxiety, patient may have hives. But having said that, in 30 to 40% cases, we can't determine the exact cause. In those cases, we call it idiopathic urticaria. But the good thing is, urticaria we can control it very well. There is a drug called antihistaminics. Those drugs like levocetirizine, cetirizine can control it very well, but you have to evaluate it by a doctor, a dermatologist, because he will help you to rule out the causes of it. So when can you rule out the cause? You can have antihistamines and control your urticaria or hives. Sometimes antihistamines alone can control your disease, and you may need some other medications to control it. Your dermatologist will guide you about that. Only one thing to keep in mind: if you are having these bumps along with your lip swelling or hard swelling in other parts of the body, especially the mucosas, then it might be severe enough to choke you to death. So this is an emergency. If you are having swelling of your lips, you need to consult a doctor immediately. He might give you some medications that help you to overcome that life-threatening condition. So these are the basics of hives or urticaria. You need to keep in mind all the points. You need to consult dermatologist at time or emergency at time. Thank you so much for patient hearing.